Today, we're diving into Unit 2, where we'll explore the acceleration behind telehealth services. We'll look at the factors driving rapid growth and how technology is transforming healthcare delivery. Here, we have answers to the crossword puzzle that reinforce key medical and healthcare terms. For example, psychotherapy refers to psychological treatment through dialogue, and triage is the process of sorting patients based on urgency or need. Deploy means to prepare and arrange resources or personnel, while ICU is the intensive care unit where critically ill patients receive specialized care. On the downside, incorporate means to include as a part of something. Diagnosis is identifying the nature or cause of disease. Underserved refers to areas or populations lacking sufficient services. And pandemic describes an epidemic that spreads over a wide geographical region. Moving on to the true or false section, it's important to note that internet service is essential for using telehealth services. Contrary to what some might think, healthcare professionals providing telehealth are not at a high risk of infection, since there is no direct patient contact. Telehealth may not always be the best alternative to face-to-face care, but it holds potential to significantly ease the shortage of medical staff. Finally, the success of telehealth programs heavily depends on having strong infrastructure and effective use of IT tools, which can make all the difference in delivering quality remote care. Let's start with what telehealth service actually is. Telehealth allows patients to receive medical care remotely, typically through video chat or online platforms, so you don't have to be physically present with the doctor. One of the biggest advantages of telehealth is that it's faster and safer, especially during a pandemic. It's also more effective and less expensive, which means patients can access healthcare from anywhere without the usual barriers like travel. According to Dr. Chong, the rapid growth of telehealth is largely due to the COVID-19 pandemic and the ongoing shortage of medical professionals, which created an urgent need for alternative care methods. During a pandemic, telehealth plays a critical role because it reduces the risk of infection by allowing patients to avoid hospitals and clinics. However, patients in remote areas still face challenges as many lack adequate medical resources and often have to travel long distances for care. But telehealth isn't without its challenges. The top three issues are the lack of proper infrastructure, insufficient technology and hardware, and poor internet connectivity. Users also need proper training to effectively use these services, which is crucial for successful implementation. Here we have a series of sentences designed to practice choosing the correct modal verbs and expressions related to advice and obligation. Notice how each sentence uses a different phrase to suggest what someone should, must, or ought to do in a given situation. For example, in sentence A, should I do is the right choice because it asks for advice about what action to take when a baby isn't sleeping well. In sentence B, had better not warns against packing too much luggage, highlighting a polite but firm suggestion to avoid a problem at the airport. Moving on, sentence C uses ought to talk to recommend that someone speak to their teacher about a test grade. Elsewhere in sentence D, had better take implies it's wise to use an umbrella because it's raining. Sentence E advises moderation with shouldn't eat, warning about eating too much chocolate. Similarly, sentence F uses ought to go to suggest seeing a doctor when feeling unwell. Sentence G should take off, encourages removing a jacket in hot weather. Finally, sentence H employs should I go to ask for a recommendation about shopping locations. Each structure helps us express different nuances of necessity, advice, or recommendation in everyday English.